It is 12 o'clock and we're going to go ahead and get started. We like to be timely with our programming. I would first like to start off by asking everyone to please remember to mute your audio and to turn your video off. You are definitely free to submit questions in the chat section for our guest today. And we're happy to have you to do that. But if we could please definitely keep in mind keeping your audio muted so we don't have any disruptions. With that said, good afternoon to everyone and welcome to this WPC Lunch and Learn as we discuss COVID-19 and child vaccinations with Dr. Michelle Fiscus. My name is Stephanie Williams, and as the president of the Women's Political Collaborative, on behalf of the board of directors and our members, I welcome you and thank you all for joining us. I would like to also acknowledge and thank the elected officials that are here with us today, as well as many familiar faces and friends. Thank you all for being here. If this is your first time joining us for one of our fabulous programs, you're in for a treat. As the president of the collaborative, I urge you all to join us in our mission to achieve parity for women by influencing policy through education, mobilization, and statewide networks. And we are built on the strength of our members. So your membership to WPC allows us to continue to bring informative programs such as this today and events to the community. Joining is a simple process. Just go to WPCTN.com. It takes 5 minutes and you're done. Back to our programming today. I want to welcome and say good afternoon to Dr. Fiscus. Thank you so very much for joining us today. I know that you're tremendously busy these days, and we appreciate you dedicating your time this afternoon to be with us today. And we are very fortunate to be graced by the presence of our co-host today, the honorable and capable Vice Mayor Jim Schulman. He's going to be the one asking all the hard questions today. Jim, I want you to know this. So I'm really clear on the seriousness of COVID-19 and the need to protect myself and others by wearing a mask and being vaccinated. I'm there. I think the only thing I really need to know today is who sent the muzzle.
That's the question you want me to ask. Is that right?
That's it. We can ask that and we're done.
It's on the, well, I do think there's some other stuff that I want to get to first, but at some point in the middle of this conversation, Stephanie, I'm going to ask that.
Okay. Thank you. I'm turning it over to you.
Thank you, Stephanie. Great opening as always. Welcome everybody on the call, members of the Women's Political Collaborative. We appreciate you all doing this. I've emceed some of these things before, and this one is going to be a very interesting program. The timing is crucial. Lots of things going on, and we're going to get into them right now. Dr. Fiscus, I know that everybody's appreciative of your taking the time to be on this call. You've been in the news quite a bit, obviously, over the last couple of months, and actually before then. For folks that don't know you, why don't we just start with the basic question? Tell us a little bit about yourself. Where are you from? Where'd you go to school? That type of stuff. And then it'll lead up to basically getting into the health department. Dr.
Sure.
Fiscus.
Yeah, so good afternoon, everybody. And thank you, Vice Mayor Schulman, for leading us through this next hour or so. And I appreciate the invitation from the Women's Collaborative. So it's good to be with all of you. So starting from the beginning, I am a New Jersey girl, which many people don't know. I lived there a whole 6 months, so it really influenced my life. Moved up and down the East Coast and in the Midwest, and lived in Indianapolis, in Carmel, Indiana, just north of Indianapolis, from high school through my residency in pediatrics at the James Whitcomb Riley Hospital for Children at Indiana University in Indianapolis. I was there the longest period of my life. I spent in Indianapolis until I moved to Nashville to do a second residency in a second residency in anesthesia with a pediatric critical care fellowship at Vanderbilt. And that was supposed to be another 5-year stint, but realized about a year in that wasn't quite for me. So I went into general pediatric practice. I am a board certified pediatrician. and actually had my own pediatric practice in Cool Springs outside of Nashville for about 17 years until I left that to go to the Department of Health.
Okay. So you're from New Jersey, ended up in Indiana, and then came down because of the residency at Vanderbilt. And for 17 years, you had your own practice,
Right.
and it was strictly pediatrics. So so basically, that's what you've done through your medical career, is deal with children.
That's right. Yeah.
Okay. All right. So how did you end up going to the State Department of Health?
I've been pretty public about my burnout story. It's hard running a practice, especially in pediatrics. Pediatricians, I like to say, are the public school teachers of medicine, where we tend not to get paid very well. The work we do typically isn't valued by insurers, even though we're preventing adult diseases. My practice was in Williamson County. And so, I started to burn out from the business end, but also started to burn out from the medical end. Williamson County has more than its share of people who are highly vaccine hesitant, if not flat out vaccine opposed. And the numbers of people coming into my practice day after day started to increase, with folks who would trust me at 3 o'clock in the morning to give them advice about what to do about their sick child, but wouldn't trust me to give them advice about whether about vaccinating their children according to the recommendations of the AAP and the CDC and the Advisory Committee on Immunization Practices. And I at one point just sort of had an existential crisis. How can you have worked with me for 11 years helping to raise your child, and then tell me that you think the vaccine that I'm going to give them to prevent HPV related cancers is going to make them sterile? I really had a hard time squaring that. And, just got to the point where I felt like I just couldn't do it anymore. And didn't really know what I was going to do next, because I didn't want to go to insurance companies or to a major medical center or to a pharmaceutical company. And then I literally opened my email one day, and there was an email to me about an opportunity at Department of Health, and I applied for that. And about 6 months later was hired and was there for about 4.5 years.
And what was the position you took at the State Department of Health? Because at that point, it would have been the pandemic hadn't started yet. So this would have been before.
Right. So this was 2016. So if you can even think back to the before times. So the initial position I took was as deputy medical director in the maternal child health program. So I was primarily working on tobacco cessation and prevention, cancer prevention, health promotion, chronic disease prevention, the mortality programs. We established the first maternal mortality review program in the state, but also pediatric fatality programs and injury prevention. And I did that for about 2 years, and then had the opportunity to, ironically, head up the state's immunization program, which I started in January of 2018. So also before the pandemic, but in the middle of a hepatitis A outbreak, and then a measles outbreak hit us. And then we went right into the pandemic.
All right. So you had switched over into that immunization role, obviously in 2018 before the pandemic hit. The role of that person, what is the responsibility of that position within the state?
So under Blue Skies, we would head up the Vaccines for Children program, which is an entitlement program that provides vaccinations at no cost to children who are covered under Medicaid or who are uninsured. That's more than 50% of the children who live in the state of Tennessee. So we have about 600 providers across the state that help provide those vaccines, and then the local health departments. We run the TENIS system, the Tennessee Immunization Information System, or the registry that is building longstanding records of people's immunizations, so that if their doctor dies or they wash their immunization card, the state has a record of it. And then we also have the vaccine preventable diseases part where we would investigate and then mitigate outbreaks of vaccine preventable diseases like measles or mumps or chickenpox or hepatitis. So that's more of the detective side of things.
Okay. I mean, in that role, and if you came in 2016, that would have been under Commissioner Dreisner.
That's right.
Under Commissioner Dreisner. Okay. And then obviously Dr. Dreisner left, Commissioner Piercy came in. So you served under two basic administrations. All right. So one of the things that I've always heard about Tennessee, because I did some work in the Department of Health, is that there are people who are reluctant to take vaccines or get the immunizations for their kids. So you were obviously running into some of that problem in your private practice, and then you went to the state, ended up in immunizations. And before we even got to the pandemic, what did you see out there as somebody who was responsible for trying to get people immunized?
Well, generally, Tennessee has enjoyed really high childhood vaccination rates, in part because of the laws that we have that require children to be vaccinated for school entry at kindergarten. And then there are also some required vaccines now for children entering the 7th grade. So we have overall had about a 95% compliance rate with school age vaccinations for kindergarten. But every year we were seeing legislation be introduced that was not friendly to vaccines or frankly hostile to vaccines, either trying to undo requirements for schools or require the department to post information that might scare people away from trying to get vaccines. And over the time that I was at Department of Health, we saw that becoming more and more aggressive and more concerning. So I think that's one of the biggest concerns that I had while I was at Department of Health was just making sure that our legislators are getting correct information and that that they're not listening to the folks that are telling them horror stories about vaccines, because they truly are one of the most important public health innovations in the history of public health.
And how did, again, prior to the pandemic, your role, the role of the department, the role of folks that went to the legislature, I guess your responsibility would have been to try to convince legislators not to start changing or bring in these different things that would actually encourage people to get less immunized or get their kids less vaccinations. Is that right? Is that basically part of the responsibility?
Yes, we would, respond to bills that had been introduced and try to make the case for why that bill might not be in the best interest of the people of Tennessee, or why it might be something that Department of Health would want to support around immunizations. But over the last few years, it's usually been on the defense, trying to prevent bills that are probably not in the best interest of public health from becoming laws.
And successful in that when trying to. I know things were changing, but in terms of being successful, in terms of playing defense and trying to get people to not change the way, because I do remember that our child immunization rates were really high, and that
Right.
actually Tennessee was considered one of the better states at this. Yeah.
Right. What might be a surprise to a lot of folks is that the state with the best immunization rates in the country is actually Mississippi, which I think would be a shock to most people. And the reason that Mississippi's rates are so high is because they have never had religious or philosophical exemptions to school age immunization requirements. All they have is a medical exemption, and medical exemptions only run about 0.1% or so of kids. So about 1 in every 1,000 children will have a medical exemption that's bona fide. But because we have religious exemptions in Tennessee, those are some 18% or 18 times or so higher than what we see with medical exemptions. We fortunately don't have philosophical exemptions, but religious exemptions in Tennessee are often used in lieu of a philosophical exemption and really can't be challenged very easily. So we do continue to have really good rates. The concern is that as anti-vaccine efforts have become more and more aggressive, especially since the pandemic, that we might start to lose some ground on that.
Okay, but even so, if we were around 95% or somewhere in that neighborhood, that's pretty good. I mean, that if Mississippi is floating around 99%, I mean, that's not bad.
No, it's not bad. I think the thing that we need to remember is that 95% is the minimum that we want to see to keep diseases like measles out of our school systems. So we know that once we drop below that 95% coverage rate, especially for MMR vaccine, that we're starting to open the door for measles outbreaks. As we get down into the 80s, we're going to see more pertussis and might start to see mumps again. So the goal is really to keep that number at or above 95%.
All right, so switch to January, February, March, maybe even before in 2020. So you would have seen this coming even before that. The rest of us were hearing about this thing, didn't know what it meant. We're wondering what, exactly what a pandemic was. So why don't you take the people who are listening through what you were having to deal with? So obviously you took over this position as head of immunization for the state, in 2018. You didn't take it with the idea that a pandemic was coming. So
Right.
All of a sudden here it comes. Starts showing up in 2019, as I remember. What do you do? What do you have to do as somebody who is basically in charge of trying to figure out, you can't stop it from coming, but obviously we knew that when it showed up, then everybody started talking about they're going to try to develop a vaccine.
And my primary role was really around dealing with this once it became a vaccine preventable disease. So, many of us were pulled into the response very early on. Of course, the Department of Health's ears were perked up in January when the first case hit the United States. We didn't get our first case until March the 5th, I think. So there was a couple of months when the operations were stood up at Department of Health, and we were watching very, very closely. I, in the early days of this, was really pulled into being a liaison with our educational system. I helped to advise the school districts, the 140 some school districts across the state, the colleges, the universities, to assist them with understanding what it was going to be like to be in a pandemic and trying to educate kids. When all we had at the time was mitigation strategies like, distancing and masking. And, of course, this information was evolving, not just every day, but, sometimes hour to hour through the early months of the pandemic too. And I actually was pulled over to the Tennessee Emergency Management Agency for a while, just to help vet vendors that were trying to sell PPE to the state. Because if you remember, very early on, we didn't have masks or gowns or eye protection in a lot of the offices and health departments, and everybody was scrambling to try to get that equipment. And so they needed someone over there who could actually weigh in on what was acceptable and what wasn't, with respect to equipment. And then at one point, because there was so much information that clinicians needed, I started hosting an every week webinar on Fridays for clinicians, where we would give some updates about whether it be about testing or antibody testing or antigen testing, PCR testing. We'd talk about where we were with development of vaccine and what that might look like, go through some of the numbers across the state and where the hotspots were. And then just allow them to ask questions, because they just didn't have a great source of information at the time. So I was very busy doing that. And then in the late summer, as we began to get word that vaccines were going to be approved, in the next few months, we started to ramp up for what that would look like, which is, basically building an entire infrastructure of providers who were willing to administer COVID-19 vaccines, and having to do that from scratch with the rules that the Fed sent down through their process for onboarding these providers, whether they were pharmacists or public health departments or doctors' offices or hospitals, and then working to develop the plan for the rollout of this vaccine, which I'm very proud to say was touted as being one of the most equitable and scientifically based plans in the country when we submitted that to CDC last October. And then working very closely with the governor and his unified command group as we rolled the vaccine out across certain populations to make sure that we were getting the people who were at highest risk for death or hospitalization vaccinated the fastest. But then also trying to make sure that we were getting vaccines in places where people were at high risk who might be having access issues. So it was a very complicated and exhausting, I'll be honest, period of time. I think we were all at the department working 90 to 100-hour a weeks working on getting this done. And then we would have things like get hit by an ice storm and have to worry about vaccines that were going to expire somewhere that needed to be moved by National Guard somewhere else, or just all of the logistics around that were really complex, and it was a pretty stressful time.
I can imagine. I can't even imagine trying to figure out how to make that stuff work. Looking back, because as I remember it, it seemed very successful. It was you needed to wait your turn. There were priorities put in place. They were made very clear. How long did that take you all to come up with that type of plan? You knew the vaccines, you didn't know exactly when they would be given emergency approval. So I assume it took several months at least to try to figure out how you would implement this. And then how did you figure out how to do it with all the counties involved?
Yeah, so we were actually required to submit our plan to the CDC October 16th, not knowing what vaccines we were getting or really what they were going to look like, necessarily how many doses there were going to be. And we didn't get vaccines until I think December the 17th. So we were really trying to. This is literally like building the airplane while it's on fire and you're flying it all at the same time kind of stuff. It was just us trying to make a plan that was as equitable as we could. And so in the beginning, the priorities were really to get those healthcare workers vaccinated, because we wanted to not only make sure that healthcare workers were safe from the disease, but we also wanted to make sure that we were shoring up the health system, because we knew people were going to start coming in sick. So those first vaccines went to the hospitals to make sure that they could get their staff vaccinated. And then very shortly after that went to the health departments, so that they could vaccinate anyone who was in those initial tiers who wanted to come to a health department and get vaccinated. And the reason for that is because we knew that if we sent it to doctors' offices, that there would be these huge barriers to getting people vaccinated. You would probably have to be a patient of that practice. You might have to have insurance so that they could charge an administration fee. You might have to schedule an appointment. So, the first strategy was to get it to all of the hospitals in the state for their staff, and then to get it to all of the health departments so that every county would have some vaccine. And then we, very early on, we only had thousands of doses of vaccines. So we had to divide that amongst the 95 counties in Tennessee and try to do that equitably, which was a combination of looking at what's called social vulnerability index. So looking at, how resilient is this county that we're working with? What is their median income? What's their unemployment rate look like? What's the education? What's the housing? What's the median income? how much access do they have to healthcare? Looking at that and weighing that into the calculations, and then looking at the population of that county and having that weigh into. So, it was a few months into the process before we could get as many vaccines to people as they wanted to get, because we were having to ration this in a very sophisticated kind of way across the counties. And we actually had some economists and really mathy people from MIT reach out to us, and they said, we read about your equitable plan and we think this is really great. And we want to help to devise a tool for you so that you can easily divide these vaccines, based on your criteria across all these counties. And they probably worked with us for 2 months trying to come up with a tool. And they finally kind of threw up their hands and said, it can't be done. We can't do it any better than what you're doing basically with your spreadsheet. And it didn't matter that, some of these people were, Nobel Prize winning economists who work with, how to equitably distribute things that are in short supply. And they finally just kind of, gave up on the whole thing and said, just keep doing you, because we don't think we can do it better, which was, was cool. And also, I think, speaks to how really complex the whole issue was, and very different from one state to the next.
Well, let me ask you a two-part question to follow up. The biggest problem with that initial rollout, and I would say first logistically, and maybe you've answered it, but maybe philosophically, in terms of what did you run into in terms of pushback? So logistically, obviously, you're dealing with 95 counties. You're trying to get a limited number of vaccines out. And, I remember those days when there were issues about the ice storms, and then I think there was an incident with Shelby County that got dealt with, but there was also, my guess would be at some point you did start running into philosophically, people who said no, whether it was nursing home staffs or things like that. So two-part question: biggest problems in terms of trying to get this stuff out.
Yeah, right at the beginning, the lines were long and people were excited. People that wanted to get vaccinated, and we had what ended up being coined vaccine tourism, because you might not be able to get it in Davidson County, but you might be able to get it in Moore County. And if you were willing to get in your car and drive an hour and a half, you could probably go get a vaccine. And so there were issues around that. But when the demand exceeded the supply, there really weren't challenges outside of the logistical things. Dry ice for the Pfizer vaccine was a logistical challenge. Having the Pfizer vaccine come in packages of 925 doses to a facility that might only be able to administer 200 of those was a huge logistical challenge. And Tennessee was in the top 5 states to roll out their vaccine program in the country. So, as you said, we were very, very successful in getting vaccines rolled out very quickly because we had practiced a lot of this. Our emergency preparedness program does something called Fight Flu TN every year, where across the state, there are hundreds of sites stood up all on the same day to vaccinate as many people as they can against influenza. That usually happens about November every year. And so every health department is involved in that. There's hundreds of sites that are set up. And then this last, the November before the pandemic, we really switched that from getting as many sites as you can stood up to getting as high a throughput through sites as you could. So we had muscle memory in how to do this. But as the supply began to exceed the demand, that's when you start to see people saying, I'm not sure that I want to get this vaccine. And for various different reasons. We have hesitancy from our Black community because of transgressions against them in the past from medicine and government. And so they have this healthy skepticism of something that is a mass vaccination campaign. then you have people who are just frankly anti-vaccine and are spewing disinformation, like these vaccines are going to cause infertility or something. And then you have people who are just hesitant that, were concerned that the vaccines maybe were developed quickly and rushed to approval. And then where it got really weird in the spring and early summer was the beginnings of this ideologic refusal to get vaccinated, that, if I get vaccinated, this is somehow placating people who represent the left side of the political spectrum. And so I will sacrifice my health, the health of my loved ones, the health of my community, and not get vaccinated because I will do anything to not placate that part of the political system. And so, we're pretty good, especially pediatricians. We've been dealing with vaccine hesitancy for more than 20 years. We're pretty good at having those discussions with people who have concerns or questions about vaccines, about the science. What we're not very good about is combating ideologic concerns about getting vaccinated. And I think that's what we've seen in so many southern states is this, kind of digging the boots in and saying, I'm not going to get vaccinated because it's what the current administration wants me to do, even though the former administration is the one that actually got the vaccines developed in the first place.
So tell me how you, as we were going through that period of time, and I remember, being so excited when I could actually sign up to get the vaccine. And then at some point, couple months, I think I got mine in March, a couple months later, it seemed like that the supply, we had more than we had the demand for. And at that point, it's like, okay, our numbers are not all that high. We're floating around 35%, 37%, somewhere in that nature, in that area. How do you go about trying to convince people that this was the right thing? We wanted those numbers up because it seems like, again, from my perspective, and I would guess from your perspective, the only way to deal with this thing is to get more people vaccinated. So how do you get those people to try to understand that this is the right thing to do?
Yeah, it was really, really challenging. One thing that didn't help us at all was the pause that was put on the Johnson & Johnson vaccine in April. Because there was a lot of excitement around the J&J vaccine, one and done, doesn't have the potential for allergic reactions that you see with the mRNA vaccines from Pfizer and Moderna. So there was a lot of excitement around that. I actually helped with the 10,000 dose event that Nashville Public Health put on back in, I think, end of March or so. So there was lots of excitement. Everybody had big events planned. And then that pause hit for 2 weeks and just really deflated all of those efforts. And even when they took the pause off the Johnson & Johnson vaccine, there was a lot of hesitancy around getting that vaccine, for what really was 14 cases of a clotting issue that they were seeing. And so, 14 cases out of millions of doses that were given, it's unfortunate that happened. And if y'all have been following the news, Johnson & Johnson has continued to kind of flounder with their vaccine even since then because of manufacturing issues with their plant in Baltimore. But I think that impacted to some extent the enthusiasm for Pfizer and Moderna as well. And then, we were also opening up vaccination to younger and younger populations as we were going along. And so we've got, a very highly vaccinated elderly population, 75, almost 80% in some of these older generations who, have frankly lived through measles and mumps and understand the importance of getting vaccinated, compared to the 20 to 30-year-olds and 30 to 40-year-olds who really have benefited from living in a vaccinated world. And so they don't see kids dying from measles, or, you know, we don't even see chickenpox anymore since, you know, the late 90s. And really have lost, I think, the feeling of vulnerability that, you know, vaccines are something that, you know, really do prevent serious disease, compared to the generation that was living through polio and still remembers not being able to go to swimming pools in the summertime in the 1950s because polio was rampant at the time. So we've continued to see this, you know, even now, I think the least vaccinated population that we have are the 30-year-olds, 30 to 40-year-olds, who, not surprisingly, also represent some of the highest case counts that we're seeing, because there's less protection within that particular age group.
Okay. So generally, I'm going to ask you a general question from that standpoint on. So we got through, you know, we got through that initial wave of vaccinations. Tell me generally what was going on with you in that position. Your job is to get people vaccinated, and that's what your job is to do. And you're trying to figure out how to convince people who may be reluctant to get a vaccination to get vaccination. Our vaccination rates were low. You're trying to get people vaccinated. And then obviously, you're no longer with the state. So I don't want to dig too deep unless you want to, but generally, what happened at that point? You did mention, obviously, there was this effort. All of a sudden, people said, okay, we're going to figure out how to vaccinate older kids. So it wasn't the younger kids, it was the kids. And then school is getting ready to start back in August. What was going on between May and August, or May of, well, we are in August right now, in terms of you? What was going on, and sort of just generally what happened?
Well, you know, things, even from the beginning, and I've been very public about this, you know, we had asked the administration, even before we had vaccines available, to start messaging publicly about the importance of these vaccines, how this is what's going to stop the pandemic, how this is how we stop variants from developing by getting people vaccinated quickly so that this virus can't spread and mutate. And, you know, we were just met with a lot of opposition to that kind of tactic. And so, you know, October, November, December, we finally get vaccines. We're still asking for public messaging, December, January, February, March, April, finally in May, we start getting some public messaging about vaccines in the state. But, you know, when you don't have a strong recommendation that's being given by people in leadership to go and get vaccinated, because it is the best thing to do for yourself, for your loved ones, for your community, people don't tend to go do it. They don't make it a priority. And, you know, we know, you know, again, decades of research in vaccine hesitancy and vaccine science, that the most important thing that you can do is make a strong recommendation to go get vaccinated. So when that isn't there, and when we're not really permitted to do that kind of messaging, you know, it really, I think it had a tremendous impact on this. And then in May, when we knew that Pfizer vaccine was going to become authorized for children 12 and older, I started to get a lot of outreach from physicians across the state saying, you know, what do we do if a 15, 16-year-old pulls up, you know, let's just say the whole football team gets in somebody's truck and says, the coach sent us, can you vaccinate those kids or not? And so I reached out to the Office of General Counsel for TDH about what is called the mature minor doctrine in Tennessee. And Tennessee is a little bit unique as a state in that it has Tennessee Supreme Court case law that dates back to 1987, so 34 years ago, that says that if a provider feels that a child age 14 and older is mature enough to make a decision about their own health care, that they are legally able to consent for that. So that says that, you know, if a teenager shows up to get vaccinated and the person vaccinating them feels that they're mature enough to, you know, hear the risks and benefits and make a decision to vaccinate themselves, that they can consent to do that. So I took the language I was given by our legal counsel, put it in a memo, and sent it out to those providers. And what ensued was a huge amount of backlash that ended up coming from some members of the legislature, to the point where some of those legislators actually called for the dissolution of the State Department of Health, because they felt that we were undermining the role of a parent in making medical decisions for their child, which is not what was going on. It was an answer to a question that was posed by our providers. So that very quickly devolved through May and June and July, and eventually culminated in my termination from Department of Health in the middle of July, largely in response to that memo that I had sent out with that information about 34-year-old Tennessee case law.
But the memo was actually, what you sent out was what the legal counsel, in terms of looking at the case law, said this is how it works. So that's what you did. But obviously you got tremendous amounts of pushback from certain people who didn't like the idea that, again, we're talking about parental control, that you had to go to parents to get permission to get the vaccine.
Right, that's right.
Okay. So I guess take us forward. I mean, so we are now in a second phase. I don't know if you're second phase, third phase. We've now got this Delta variant that's moving around. And it's almost as if, based on the Today Show this morning, I think Florida hit a record number today of people who are either hospitalized or who have the virus. So did you all know, was this something that was sort of understood that, I mean, we knew there could be a second wave. I don't know if we knew that this was coming as strong. Was this something that you all realized was going to hit at some point?
We did, we knew, just because the vaccination numbers are so bad, even now we're sitting at 40, low 40s for people who are vaccinated. And, this is what viruses do. Viruses mutate, and, their sole purpose is to go find another host to infect and make more copies of themselves and go on and infect the person after that. So we knew there would be mutations in these variants that we're seeing. There's variants beyond Delta, there's Lambda coming, and others. And, as long as we have a susceptible population that's not vaccinated, we're going to continue to see this virus evolve and try to get around any kind of defenses that we throw up. So yes, we knew Delta was coming. We knew it was more infectious than the first virus that we'd seen. When you look at numbers, so just by comparison, the first SARS-CoV-2 that we were seeing had what's called an R naught of about 2 to 3. So that means for every person who gets infected, they're going to infect 2 to 3 more people. Now we have Delta variant that has an R naught around 6 to 8 or so. So for every one person, they're going to infect 6 to 8 people. So it's a lot more transmissible. And then if you look at something like measles, it has an R naught of 12 to 18. So we're not that bad yet. If SARS-CoV-2 was measles, we would be in just unimaginable shape right now. But this variant is highly transmissible, and we're seeing it infect children, where before we really didn't see the first SARS-CoV-2 infect children, or at least they weren't getting symptomatic. It may be that they were under tested and maybe it wasn't identified as often in children, but we really think children probably just were not getting infected as much. Now we're seeing huge numbers of children getting infected. They represent, I think as of yesterday, it was 36% of the new cases that we're seeing are in children. And then some of those children are getting quite sick. So we've got these mounting numbers because people are basically going about their business. I was out yesterday, had to run into the mall for something, and I had on a mask and I was keeping my distance from everyone. I'm obviously fully vaccinated. But probably 90% of the people around me were not wearing a mask and really acting like we're not in the middle of a pandemic. And so it is both, it's this perfect storm of COVID fatigue and people just being tired of dealing with this, and a more transmissible variant that we're seeing now, unfortunately. And also maybe some waxing or waning immunity from people who were vaccinated January, February of last year. That, really has Tennessee in a position where we're going to continue to see just tremendous amounts of spread. And now we've got kids in school. And those kids are they're just sitting ducks. They're sitting in a small classroom where they can't possibly physically distance. We don't have mask mandates. The governor actually put out an executive order saying that parents could opt out of any mask mandate, which means basically there's no mask mandates. And, we're seeing, not surprisingly, massive numbers of cases amongst children and teachers now that is threatening the ability for schools to remain open.
All right. So, as somebody who has been through this and been on the front lines of this, I consider you an expert in this area in terms of trying to deal with this. It is terrifying to watch those numbers go up. It is scary to see what's happening to children. So as somebody who's been dealing with this, what steps should we be taking at this point to take care of our children? They're back in school. I'm watching the chat box. There are people reporting in about, schools closing down because everybody's getting sick. We know that we had a number of kids sick at metro schools. What do we do? What's the best thing for us to do?
Well, if you remember last year, there was a virtual option for kids to be able to learn from home if they had to. We all know that in-person learning is the best possible thing for children. But they've got to be able to do that in a space that is safe. And so full transparency too, I sit on the board of directors for the American Academy of Pediatrics, representing the Southeastern United States. And it is the opinion, the expert opinion of the American Academy of Pediatrics that kids should be in-person learning, and that they should also be wearing masks if they're over the age of 2, regardless of vaccination status, that everyone indoors in public should be wearing a mask. And that is, such a small thing to ask of people to limit the spread of this virus. And it's not being done. And honestly, without a mask mandate, it makes it very difficult for children who even, want to do the right thing to comply because of peer pressure. So, if there's a rule that you have to wear it, they'll wear it. And a lot of those kids want to wear it. But if there's no rule, then you start to see a lot more bullying and pressure to not wear those masks. There is no way to space these kids out. Last year, if you remember, some schools had some grades on one day and some grades on a different day. We talked a lot more about cohorting children so that you kept a small group of kids together so that if one of them became sick, you were only having to quarantine a small group of kids instead of maybe an entire classroom. I haven't heard anything about cohorting. And I really feel for these school districts because, really from the beginning of this, they have been on their own to try to figure out how to navigate these issues. There has not been direction from Department of Education. There has been minimal direction from Department of Health in helping these school systems to navigate what to do. They themselves are dealing with their own challenges with their school boards, with political pressure, with fringe groups that pop up that are anti-mask. My husband sits on the Williamson County School Board. And so, that school board made national news last month when there was violence and threats against people who spoke in favor of having a mask mandate for Williamson County schools. So it is an incredibly polarizing issue for reasons that just still befuddle me. Let's just say that we're completely wrong about masks helping in this situation. The cost of having worn them in a school setting is minimal compared to not wearing them and seeing rampant cases. that I forget who it was that said the definition of insanity is doing the same thing over and over and expecting different results. That is what we have right now. We have folks that are like, you know what, we're not going to mandate this. We're going to gently encourage people to do the right thing. And what we see are cases skyrocketing. And, Tennessee now has the second highest cases per 100,000 children of any state in the United States. We rank second for the number of cases amongst children. And that is a travesty, and it spells tragedy if we can't do the right thing to keep people safe.
You made a point that I've told people. It just seems like such an obvious thing. Even if it turns out, if we look back in 10 years and go, everybody wore those masks, but it turns out that it really didn't help. At this point, that seems to be, particularly for kids who are too young to be vaccinated, wearing a mask seems to be the best chance we have to try to stop the spread, particularly among school children. So why wouldn't we just err on the side of having kids wear the mask?
Well, and the other thing that we've really seen gone by the wayside is real attempts at quarantine and isolation. And so last year there was a lot of cooperation between school systems and their local Department of Health to make sure that seating charts were shared, and that the school was letting the health department know when they found out about a case, because sometimes the school is the first one to know. And then they would look at those seating charts and they would get the right kids quarantined. And yes, it was extremely disruptive. And it's a pandemic that has killed hundreds of thousands of, almost over 500,000 people in the United States now. In Tennessee, 1 out of every 514 Tennesseans is dead from this pandemic. 1 out of every 514. That's not 1 out of every 514 cases. That's 1 in every 514 Tennesseans that is dead. And so what we've done from the beginning of this is we aren't going to mandate masks. We aren't going to try to contain things. We're not going to do earnest contact tracing and quarantine. We're not going to require people to abide by quarantine and isolation. And so, what we're seeing is that we continue to be at the bottom of the barrel for vaccination, and among the states with, now one of the highest case counts amongst children. And I think the other thing that people don't realize, they'll say, oh, well, how many kids die? Well, there's a lot more to this than death. We've had 15 children die, but that's an increase of 50% in the last month. That is going to continue to increase. Children are resilient. It actually takes quite a while to kill a child. And so it is a very, very lagging indicator in children. But what we do see is multisystem inflammatory syndrome in children, or MIS-C. And Tennessee continues to be one of the states with the highest counts of MIS-C. We have 177 identified children who have been diagnosed with MIS-C. And these kids have maybe mild COVID or even asymptomatic COVID at the beginning, and then 3 or 4 weeks later, suddenly go into multi-organ system failure. 89% of these kids have heart damage. More than half of them end up on the ventilator. More than half are in the intensive care units. And these are kids that are school age, and the median age is 8. That are contracting this virus, going on to develop MIS-C, and are probably going to have their lives shortened. They're not going to die right now, but they're not going to live the normal full lives that they would have had they been protected from getting this virus.
But COVID is killing some of our kids. It's a part of what is causing some of children in the state to die.
Right.
And
we've had 15 deaths so far. Okay. And, to me, that's 15 too many.
And it's going to continue on because of what's happening. 2 quick questions. We're running out of time. Somebody asked, when can we expect a vaccine for 5 to 11? Do you know where that is?
Yeah, I wish I knew. They had thought we might have it late summer. I think the FDA really wants to dig in some more into some of the reports of myocarditis or some heart inflammation related to the Pfizer and Moderna vaccines. So they're saying probably late 2021, possibly early 2022 before we're going to likely see that 5 to 11 indication.
And do you think, and this is so weird, I mean, under that, 5 and under, are they going to work on that too?
Well, they're in clinical trials, so down to 2 months. They're studying the vaccines, and it's a matter of time. You have to have a certain number of children that get enrolled. You have to watch their data over a period of time. We have to get them at least 2 months, at least half of the kids beyond 2 months from their second injection, and then monitor that data after that. So it takes time to do that. I have not heard that they've fully enrolled the cohort yet for the 2 month to 4-year-olds, but I would be doubtful to think that we would have that before the second quarter of 2022.
I know that here in Nashville, we see a lot of, we're seeing surrounding counties, Williamson County, I think Franklin City Schools, we're running into problems. Is this happening all across the state? I know we get sometimes just our localized news, and I know we've got situations in Davidson County. Are these numbers happening all across the state?
They are. And, yesterday, Tennessee's test positivity rate was almost 20%, which is extremely high. The WHO wants us below 5%. So 20% test positivity rate on a state average is terrible. We have some counties that are in the 30s. 1 out of every 3 tests that they do is positive for COVID now. Every county in Tennessee is a high transmission county. The recommendations are that we shouldn't be having sports, high risk sports for kids when we're in high local transmission. We should have mask mandates. We should have people, being vaccinated in huge numbers. We're still in the lowest 6 states or so in the country for vaccinations. We're surrounded by states that are also very low for vaccinations. So, it's not just your county, it's your state, it's the Southeast of the country that is just a hotbed for this continuous spread. And I am very concerned that if people don't get with the program and get vaccinated and start doing these public health measures that are very simple that we know are effective: masking, washing your hands, keeping at a distance, not congregating at concerts and motorcycle rallies, giving our kids a virtual option when there are cases in classes and in schools. If we don't do those things, we're just going to continue to see this virus continue to mutate and continue to be here with us.
I think you said it very, very well. We have about a minute and a half, and I know Stephanie wanted to know about this muzzle. So that's going to be the last question. What can you tell us about this muzzle that you got?
Yeah, so if you didn't hear it, in the beginning of July, I had a dog muzzle delivered to me. I've quipped a little bit about that it was the size for a beagle. And when I went public with everything that's gone on and my criticism of the management of COVID-19 by this administration, I quipped that I'm clearly a pit bull and that it should have been 3 sizes larger. It was delivered to my office and apparently done so through an account that was set up in my name at Amazon, using an old credit card number of mine. So when the state investigated it, they determined that I had sent the muzzle to myself. They didn't do a very thorough investigation, we know. So I actually asked for an investigation by Metro Nashville Police Department's fraud unit that began this week. And we hope to be able to identify the person who used my identity and my credit card and prosecute them.
So we haven't heard the last of this yet. It is being reviewed. All right. Dr. Fiscus, I really appreciate you spending time. It's 1 o'clock, so we have to stop. There are a million more questions. The chat box is full of stuff. I know that we have to end at 1. We could go on for another couple of hours. What I would say is thank you for agreeing to be on. Thank you for what you've done and for what you continue to do. I can't imagine your responsibilities trying to figure all this stuff out and then having to deal with a lot of difficult issues. And now you're still trying to help save Tennesseans. And for that, we all are very appreciative.
Well, thank you. I, as a pediatrician, as a mom, as someone who is very passionate about public health, there isn't anything more important than making sure people have the facts and get themselves protected and protect their kids.
Well, I'll end on a response that I just saw. It said, thank you for watching out for our children. So thank you. Ladies and gentlemen on the call, it is 1:01. We went overtime. We probably could have kept going. Like I said, thank you everybody for being on. Again, Dr. Fiscus, thank you for being a part of this. And everybody stay safe and listen to what Dr. Fiscus said. Everybody signing off. We'll see you next time on another WPC program. Thanks, everybody.